Hello, this is Dr. Umesh here. I've been practicing in the Bangalore for the last 30 years. So I was earlier faculty, and I'm here to answer some of the common queries asked by the pet parents on the allergy diseases and the tick-borne diseases. And I will try my best to give a answer briefly as much as possible. Thank you. The moment.
What is tick fever? How can tick fever be transmitted?
Tick fever is a general term to a group of diseases which is transmitted by the bite of a ticks. Nowadays, it's become very common. Probably, I would say it's an endemic in India. And obviously, as they say, tick-borne is always transmitted by the ticks, bite of the ticks. The biggest issue is that all the stages of ticks are can transmit the disease, and it's a transvoverian as well as a transstadial infection is possible. And there are a lot of ticks which are carriers, and they can reinfect the dog many times. So that's the biggest reason why it becomes so unsuccessful many times in controlling the tick-borne infections.
What are the clinical signs of tick fever?
That depends on the cause of the tick fever, because tick fever can be because of a E. canis, or it could be babesiosis, or it could be anaplasma, or even the hepatogenous canis. But most often what we see in India is the ehrlichiosis and the babesiosis are very common, and it's not surprising to find other co-infection with anaplasma or the combination of the infection. So signs of this infection varies. So for example, in the ehrlichiosis, you may not find the symptoms initially, that it may clinically normal. The dogs may not show any signs for the first 2 3 weeks, or some dogs may be presented with the acute sign of a bleeding from the nose, or the bleeding on the skin, inhabitants, or bleeding inside the body. And some dogs may show simply the fever. So every dog has a different manifestation of the ehrlichiosis. So likewise, babesiosis is also very risky problem. Is the biggest problem in our country, because we have a Babesia canis, Vogeli, and a Gibsoni. Gibsoni is probably the one which causes a lot of complication. Canis and Vogeli can be easily manageable. So most babesiosis are presented with fever, enlargement of the lymph node similar to ehrlichiosis, inhabitants, and sometimes with bleeding. Or some dogs may be presented with a jaundice or severe anemia, life-threatening anemia, or it could be presented with a respiratory issue, or it could be presented with simply the DIC, which may be very acute, and the dog can suddenly die. So it depends on the severity and also the balance against the immunity in the dog. So it's very difficult to specify the symptoms. It is a wide range of symptoms, because it can cause a kidney problem, it can cause a pancreas problem, it can cause a cardiac problem as well.
Considering different causative organisms of tick fever, how do we arrive at the treatment protocol?
Yeah, when you suspect the tick fever, is always better to confirm the diagnosis. Nowadays, we have the lab test available. It can be done by the side of the animal itself, with the kids, or we have the PCR, which is a very popular. At the moment, PCR is the most reliable for the diagnosis, and that's the most recommended method. So most veterinarians make use of the PCR, which is widely available in all the cities.
What is the treatment protocol in case of babesiosis?
The treatment of babesiosis is always a bit challenging. It depends on the species. Some of the species like the canis or the Vogeli can be easily treatable with the available medication. Whereas a Gibsoni, at the moment, we do not have any drug which can clear the 100% infection. So some of the most recommended method is using a atavacone with the azithromycin. That is the most popular. Some people use the triple therapy, and some people use even the injection called the Berinil. So we cannot say which is the right one, but at the moment, atavacone and azithromycin may be a good initial choice, which is relatively more successful compared to any other combination. But doesn't mean that every dog in the atavacone and azithromycin get cleared with the infection.
Does atavacone offer advantage in case of Babesia gibsoni?
Atavacone is always advantageous because it is a tablet. The Berinil injection is not yet approved for use in dogs. So sometimes the dogs can develop the very life-threatening adverse effect. So we always take the consent from the owner whenever you give this Berinil injection. Atavacone azithromycin is a well tolerated, and atavacone has to be given 3 times daily for 10 days, along with the azithromycin given once a day for 10 days. So you do find a great success with this combination, and that's what you are seeing in the practice at the moment.
What is the dosage regime for Vacone?
Ocone or the Atavacone is generally recommended at 13.3 milligram per kg per kilo body weight every 8 hours for 10 days.
Are there any contraindications on safety measures to be followed while giving Vacone?
Vacone appears to be very safe because this is the drug which work inside the mitochondria by inhibiting nucleic acid and ATP synthesis. It's a broad spectrum antiprotozoal drug. Probably the only contraindication at the moment may be that on the pregnancy and the lactation because we do not have enough data. Otherwise, we are not seeing any such contraindication of using atavacone at the moment. However, dogs can develop the adverse reaction to any drug, similar to antibiotics and so on. One has to watch for this any of the adverse effect. Otherwise, it's a well tolerated drug in the dogs. Thank you, Dr. Babita, asking for this wonderful question. I know these are the common queries asked by the pet parent. We tried best to answer this question very briefly, and if you need a further information, please ask your vet. Thank you. Hopefully, we answered some of the queries.